Unfortunately, most substances don't go into breast milk at a very high concentration. For the most part, they're much lower than they are in the blood, but there are some exceptions. One is iodine. Iodine, in particular, if you have to have your thyroid treated with radioactive iodine, that's very dangerous, both during pregnancy and breastfeeding. There's dried seaweed, and that has a lot of iodine, and you really shouldn't do that either. So before going to get things from a health food store or whatever, you should talk to your doctor or healthcare provider about the substances. Another drug that we get concerned about is given frequently is Demerol. If you have a cesarean section and you have pain, you need something for pain, and so Demerol is given frequently. But if you feed the baby and then take the medication, you might be able to minimize the transfer, because that drug can make the baby very groggy and make it very difficult for the baby to feed. Sometimes if you're taking a medication that your doctor's concerned about, you can pump the breast soon after you take the medication, discard that milk because it might have a higher concentration, then pump again for the feed at a later point during the day, say an hour later. First, you have alternatives to that mother's breast milk, because you can obtain breast milk from other women who have been pregnant before, but it's best to go through a milk bank to get that rather than to do it directly. And then of course you have formula that has improved over the years, and now they have formulas that are designated for premature babies, but they're not as precise in the number of weeks as breast milk is, but they're better. And also these formulas have active cultures in them, some of them, like you get with yogurt, where you have active cultures, and that tends to minimize any diseases to the GI tract or the bowel. So formulas can be, you can raise a healthy baby on formula.